Calling in the pros, the probiotics, but truly the real pro here. Also, Dr. Maggie.
99.99999% of people on the planet and doctors have no clue of anything about digestion, which is why digestion is huge in the Transform program, and we teach a ton about it. However, it's not just innately genetically whether you digest or not. Do you know that the gut bacteria you have in your gut also determines how you digest your food because they can help break down the food in the stomach, in the small intestine. In the large intestine, these bacteria are critical
Mhm.
because they actually take the food that you have and what we call prebiotics. Prebiotics, we'll talk a little bit about more later. But prebiotics will feed the good bacteria. But these good bacteria take prebiotics and it will ferment them. And that fermentation is a critical part of digestion because in that large intestine, that fermentation process is what will really cause a lot of what we call beneficial things to be made, called short chain fatty acids. These short chain fatty acids will go and it's helpful for people with chronic fatigue, helpful for balancing hormones, it's helpful for breaking down toxins. I mean, you name it, it's critical. It's even critical also, this whole process that's happening in your gut to even create and make vitamins. Vitamin K is made by the bacteria in your gut, and low vitamin K2 will cause you to have chronic fatigue syndrome. All of you guys thinking like long haul C word, all of
Mhm.
you with chronic fatigue syndrome, they have actually found that if you don't have enough good bacteria to make vitamin K, also specifically, you don't have bacterial strains that create and ferment to create a substance called butyrate. If you don't have a lot of butyrate creating species, this is why some people get long haul fatigue. The difference between someone who gets chronic fatigue and someone doesn't could be one or two strains of bacteria in their gut.
Wow. So this is a fixable problem.
That is the key message here. There's it is so fixable, it's not even funny when you actually start to understand just how many different types of bacteria and what their specific functions can be. We can actually even at this point, I mean, I do this where you can actually look at someone's stool and look at these products fermentation and say, "Oh, you're actually really low on these strains that create butyrate. You are low in strains that are making this particular vitamin. You are not going to be breaking down your hormones well because you're actually too much of this bacteria, too little of this bacteria." It can get really granular when you really start to understand bacteria to be like, oh, what? Hormone balancing has to do with bacteria? Oh, hell yeah, it does. Always remind people that there's two major areas for hormones to break down. Step one is in the liver, step two is in the large intestine. So, if you don't have good bacteria in the large intestine to really finally break down those hormones and take it out, it's like a bathtub scenario. And
Uh,
it's like, if you have liver break down the hormones, you have a faucet filling the tub. If
mhm.
you have good bacteria that finally breaks it down, it's the drain that drains it out. Otherwise, you're just filling the bathtub. And that stuff that's in the bathtub, what we call hormone or toxin intermediates, can build to be a toxic, huge pond of this. Digestion isn't just about your stomach, it's about your large intestine with fermentation, which is done by the bacteria in your gut, not your gut cells, the bacteria in your gut.
You have so much to teach on this. I can tell. It's like you can't get the words out fast enough because this is something that you don't really hear much about. And then you have a comment like this that I have microscopic colitis, can't even handle probiotics well, broken digestive system. Any advice?
There's so many layers to that question that shows you just how ill-informed our providers are.
Mm,
Because she or he is bringing us some really good points. For example, why is it some people can't even take probiotics?
mhm.
Why is it some people is it because they're allergic to probiotics? No.
Can't be.
And what it is that they may have so many bad bacteria in the gut. When you introduce the good bacteria, it actually causes some of the bad bacteria to die. You can actually, with good bacteria, cause bad bacteria to die. And when these bad bacteria die,
Makes you feel
they
worse.
open up and release their die off. Like their inside of their bacteria has what we call LPS, lipopolysaccharides, which is a toxin. And so when a lot of them die off really fast, they release this huge surge of LPS toxin.
You feel
And
bad.
that makes you feel bad. And you're like, oh, I'm allergic to this probiotic. No, the probiotic is doing its damn good job, but you have a toxic stew of bad bacteria in you. It's a sign.
So it's not just a matter of stay the course. It's that you really need to be working with a provider, it sounds like, that understands that very delicate balance and can properly guide you on the right time to introduce the probiotics in a whole host of other
For
treatment.
some people, yes, right? That's why for me, it's like the transform program is really comprehensive. And the other part of this question, I think that's critical. She's bringing up, I have a broken digestive system. But the
Mhm.
mere fact that this person says this, you're super smart and you're smarter than all your doctors. Because a broken digestive system will cause bad bacteria to grow and proliferate. This is really important. And that's why I'm like, this digestion thing is so holy grail. I am literally the only functional medicine physician around, especially in the autoimmune space or anywhere that's really saying digestion is actually the root of this problem.
Mhm.
Because what happens is, let's say there's so all these steps in digestion, right? But let's say it starts with even like in your sinus and your teeth. You know, you have a
Mhm.
chronic dental biome and sinus biome and throat microbiome of bacteria here. But if you have a chronic infection here, and I'm telling you, all of you with autoimmunity, most of you have some dental problems, huge chronic sinus ear infection histories.
Mhm.
This sucks and it's seeding down. But here's the problem, if you don't have, let's say the first step of digestion is in your stomach is having proper level of stomach acid. 90% of you genetically don't even have adequate amount of stomach acid if you have autoimmune disease genetically.
That's one mark
That,
against us there.
that stomach acid kills the bad bacteria. So then you're just sitting here like, welcome to Fantasy Island. I'm dating myself.
We're
There
all
are no armies of defense here whatsoever. Come on in and set up shop. The pH in our stomach, most of us is not even acidic because 90% of us don't have good, adequate amount of stomach acid. And as a result, we are just inviting it in, open door policy, no defense, even the first line defense, not even talking about later on.
Mm.
So digestion is the start. And listen to Carla, my digestion problem started at a root canal.
Mhm.
Well, the other thing is that some of these bacteria in your gut is contributing to the digestion. And if let's say she had a root canal because she had a ton of bacteria in her dental microbiome, all that bacteria shoom is going straight into your gut. Guess what
Mhm.
happens is it can actually push out some of the good bacteria that's working in there. Whoosh, her digestion problems really start. That's a huge shift in the bacteria from being balanced with between the good and bad. Sudden influx of bad, there's a big shift right there.
Yes.
And that can happen after a root canal. If you understand just this one topic, that was just 1% tip of the iceberg on this one topic. And this is the kind of education that I think is really crucial for people to learn how to turn around their autoimmune disease naturally. So if you want to learn more about the program, we're going to put a link in chat. You can start a chat with our team to learn more. Click the link and message our team to learn more. We have so many resources that we'd love to share with you.